Hello, everyone. We're here today with GU Oncology Now with the ASCO Bladder roundtable discussion. My name is Vadim Koshkin. I'm a GU medical oncologist at the University of California, San Francisco, where I help co-lead the bladder cancer program for the medical oncology side. And we have a great panel with us here today, and I'll let the panelists introduce themselves, starting with Matt.
Hi, I'm Matt Zibelman. I'm an associate professor of GU Medical Oncology at Fox Chase Cancer Center in Philadelphia and director of clinical research of the GU service line.
Hello, my name is Cora Sternberg, and I'm a genitourinary oncologist and professor of medicine at Weill Cornell Medicine. I'm also the clinical director of the Englander Institute for Precision Medicine at Weill Cornell. Happy to be here.
Hi, I'm Dr. Dan Petrylak. I'm professor of medicine and urology at the Smilow Cancer Center, Yale University, and happy to be here as well.
Great. Well, again, a wonderful panel here, and our topic here today is really the treatment strategies for advanced bladder cancer. So with that, I think maybe we'll conclude by asking, each of the panelists, what are your, and we've discussed some of these already, but what are the most impactful studies in bladder cancer that you see at this meeting, and what do you kind of most look forward to, dissecting more?
Well, I think that we've seen a lot of progress. I mean, for 30 years, all we had was MVAC and gemcitabine platinum. So with the advent of 5 new immunotherapies and 2 antibody drug conjugates and erdafitinib, we have really seen quite important advances. I don't know that this meeting has so much more different. I think the only really new study that we're going to be seeing is the results of the NORSE study in the platinum ineligible patients with the combination of erdafitinib and immunotherapy. That'll be a new study and something different that we haven't seen yet. I don't know if it's going to change practice because, again, only one in 10 patients are going to be FGFR 2 or 3 positive.
Do you want to go next?
I would agree. I think the THOR study and the NORSE studies are both important trials. They're really validating the FGF target for this disease. Certainly, we're going to see a further presentation of the EV-103 cohort A data, which is very, very similar and confirms what's been seen previously with this particular combination. So, I think that the future is really going to depend upon biology. How do we select these patients? Can we find a marker for enfortumab or sacituzumab? Can we find a marker that will tell us whether we should give immune therapy again or not? It's going to be more complex to do these trials because we have other drugs that are in the pipeline at this point. So how do we design clinical trials in this particular era of new drug discovery? It's going to be a challenge.
Yeah, I think you guys stole a lot of the good ones. I think the EV Pembro follow-up is will certainly be the most exciting, and I think the biggest practice changing, although I think we're already often going to be doing that now at this point. And I think really I'll highlight that we now are ready and need new targets and new potential drugs. I think we have had the ascension of some of these therapies now and become part of standard of care. And I think now really we need to get new areas to go after or new drugs that look promising for some of our patients. Because if you look at ASCO this year, there's not a lot of that. There are very few sort of results from phase 1s and new promising drugs that are out there at the moment. And so I look forward to hopefully seeing that increase in the near future.
Yeah, like maybe even with the antibody drug conjugates targeting other things like we discussed.
Yeah, or maybe other immunotype therapies, whether it's more bispecifics or T-cell mediated therapies that we're starting to see come into some other places, and whether there can be a role for those in urothelial carcinoma.
We're participating in an NCI trial with Andrea Apollo is leading it with urothelia and non-urothelia for patients with primarily HRR abnormalities, but also other biomarker abnormalities with olaparib to look if a PARP inhibitor can work also in urothelial cancer. Should be interesting. I don't know any results yet.
Yeah. Well, again, I want to thank this wonderful panel for your wonderful thoughts on this fascinating topic, and thank you for your attention.